Are you suffering from back pain but have no idea what to do next? In this video, I want to outline the most important first steps to help you on the road to recovery. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the treatment and care of other people, perhaps like yourself, who also suffer from back pain. So we all know that back pain is extremely common, and what I've noticed since becoming a physiotherapist who specializes in back pain care is that I'm often asked to give quick and easy advice to people, whether I'm at a dinner party and I'm sat next to someone and I tell them I'm a physio and they tell me they've had sciatica and they ask me some advice on how to manage it, or perhaps a friend of a friend will say, "Oh, can you help my friend out because they've been diagnosed with a bulging disc or something like that." This is a fairly common experience. Unfortunately, due to the complexity of back pain, it's actually a really, really difficult question to answer without doing a thorough assessment on someone. So unfortunately, unless I see and assess someone properly and fully, the advice I give, generally speaking, is as likely to be ineffective or perhaps even detrimental as it is to be beneficial for that person. However, I don't mind being asked for advice on back pain, and I like to be able to help people where I can. So what I've done is speak to various clinicians, people I work with, other clinicians who I have associations with, to try and come up with a list of initial back pain care advice that might be consistent across a broad group of back pain sufferers. So who is this advice for? It's quite a broad population of back pain sufferers. So this is for anyone who has back pain that is more than just a little bit of soreness. So, obviously if you go for a big run or go to the gym, you might have a bit of DOMS in your back because you work the muscles. That's not what we're talking about here. We're talking about something that's a little bit more than soreness or a bit of discomfort that's lasted for more than a day or two. This is also advice that's valuable for someone with recurring back pain. So someone who's had incidences of back pain that have repeated, 2, 3, 4 times. This is also valuable for someone who has back pain above a certain severity, more than just a niggle or a bit of soreness. This advice is also for someone who has had a diagnosis of their condition, but no real advice on how to treat or manage it. And this is a surprisingly large and common group of people. So perhaps your doctor has told you have mechanical back pain or non-specific back pain, or maybe something like a facet joint irritation, or perhaps you've even gone and had an MRI and you've been diagnosed with a prolapsed disc or a herniated disc or a bulging disc, but haven't really been given a specific course of treatment on how to manage your back pain yet. So this is actually quite a huge cohort of people, quite a huge population of back pain sufferers. But unfortunately, it's the type of back pain that tends not to be treated very well, or it tends to be sort of the type of back pain that gets kicked down the road and only gets treated seriously when it gets a lot more severe. And in my opinion, this is one of the reasons that back pain is such a massive problem and it's so ubiquitous in our population. So if you fall into any of those groups of people, here are 5 pieces of advice that I could give you that is consistent for this group of people, which actually accounts for the majority of back pain sufferers. My first piece of advice is don't panic. I know a lot of people have a story of a friend or an uncle or whatever who suffered horrible back issues and ended up in a wheelchair, or was debilitated the rest of their life. The truth is, if managed sensibly, most back issues can absolutely be managed extremely effectively. So if you are someone who's experienced quite severe back pain or even recurrent back pain, take a deep breath, make the decision to manage it sensibly and effectively. The second piece of advice, really important, avoid total rest. We know that one consistent thing in back pain is the back likes movement, it likes changing positions. So things like walking, even things like gentle swimming, as long as it's within a pain tolerance. Obviously, you don't want to be doing anything that irritates things. You don't want to be doing anything that causes too much pain, but you want to move as much as possible within your pain-free tolerance. And certainly avoid total bed rest. That won't help you get better any more quickly. The third tip, if it feels good, it probably is. And this is a sort of my antidote to the very common question of, what exercises should I be doing if I have back pain? What stretches should I be doing if I have back pain? Like I said, without an assessment, I would just be guessing what would be appropriate for you. However, fortunately, in this regard, a bit of common sense actually holds quite true here. So if something feels good, it's relieving of your symptoms, it's probably a good idea to lean into that a little bit. On the flip side, if something hurts, if something is causing you irritation of your symptoms or making you feel worse, obviously it's a good idea to avoid that at this point. The no pain, no gain mantra has no place in the early stages of back pain when you're just trying to sort of manage it in the initial stages. So don't ever think that you need to push things to make them better. If it feels bad, it probably is. And if it feels good, it probably is. Fourth point, and where a lot of people slip up, get seen by someone who can help you. So most people, in my experience, look for help, treatment, and advice way later than they should. So this means, firstly, that they've suffered unnecessarily, which is always a shame. And also, they've often let the condition deteriorate to greater severity, which then, of course, means the rehab, the treatment for it, is going to be much, much more significant. An analogy we often use here at the clinic is, we all, we know what it's like to clean dirty dishes. It's often very, very tempting after using a dish to just, leave it to the side to let future you deal with it. But of course, if you cook oats in a pan or something like that and leave it to the next day to clean, it's going to be much more difficult to clean it. Same idea with your rehabilitation. The earlier you get on it, the easier it's going to be. I would add, with all respect to general practitioners, in terms of being seen, in my experience, being seen by your GP isn't necessarily sufficient, because certainly here in the UK, the way the system works is obviously GPs can be great for giving some basic advice, for prescribing medications, and for referring you to someone else. But they tend not to actually do anything actively to help with your back pain. So when I say get seen by someone, I mean be seen by someone who can actually help you there and then with some actual treatment, something like an osteopath, a physiotherapist, chiropractor, someone who specializes in the treatment of musculoskeletal conditions like back pain. Point number 5, control the pain. And actually, this is where going to see your GP or your first point of contact physician is actually a really, really good idea, because they can talk you through medication, pain relief options that might be available to you to be able to manage your current symptoms. I'll let you in on a little secret. Every single patient who comes in to our clinic tells us how much they don't like taking pain relief. It's a very, very ubiquitous statement. Everyone says it. I understand people's concerns with taking medication, and of course, medications need to be taken as directed, and of course, not abused. But that's what your GP is there for, to prescribe you the correct medication and advise on correct application. However, it's really important to manage your pain levels. This will often then make this sequence of advice a bit circular, because if you manage to lower the pain, manage the pain a bit, that loops back to point 1 of don't panic. People tend to panic when they're in pain, and that only worsens things. So if you manage the pain, you're less likely to panic. And also, if you manage the pain and don't panic, you're more likely to remain active and give yourself the best opportunity to recover and heal. So by following this sequence of advice, you set off a spiral of rehabilitation that tends to lead you down the right pathway. So there you have it. The only advice that I and the clinicians I collaborated with on this could come up with that is consistent among a large group of back pain sufferers. This is the advice I can give before thoroughly assessing you and giving you and having a better idea of what you need to do then specifically moving forward. So don't panic, no bed rest, don't rely on bed rest, keep active within pain-free parameters. Number 3, if it feels good, it probably is. Number 4, please get seen. It's the best investment you will make. And then number 5, control the pain. I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you did enjoy the video, please give it a like and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your road to recovery. Thanks again for watching the video, and I'll see you in the next one.